For the last decade, I've been on a mission to help people find expansion in their lives through holistic well-being, physical, mental, and spiritual. This journey, of course, started within with my own healing and then expanded outwards in my career teaching movement, meditation, and healthy eating, as well as practicing energy and sound healing. Through this journey of self-discovery, I have come to learn that my core purpose is to use my voice to facilitate healing for others. On this podcast, I interview expert guests to share some of the tools, approaches, and thought processes that have helped me delve deeper into what it means to be a spiritual being living a physical existence. Dr. David Wepener qualified in homeopathy, naturopathy, and osteopathy 40 years ago and is registered with the Allied Health Professions Council of South Africa. He has been in private clinical practice with a 6-year period in executive health management and 6 years as a hospice trained facilitator, trainer, and caregiver, supporting bereaved families and terminally ill patients. Additionally, Dr. Dave studied traditional Chinese medicine and acupuncture, has assisted with acupuncture anesthesia for childbirth as well as fertility support, and offers maternal and postnatal homeopathic care for moms and babies and their follow-up throughout their lives. He has taken a deep dive into addictionology, trauma, and PTSD, as he sees more of this suffering daily, and his study of PsychoNeuroImmunology, PNI, NeuroLinguistProgramming, NLP, and modern neuroscience, as well as his certification as a mindfulness teacher, has enabled him to practice a fully holistic form of medicine, embracing the totality of a human being. When I asked him why he does this work, he answered, "My passion and privilege is participating in a person's journey to wholeness and integration, while taking care of body, mind, and soul." When I read this response, it actually brought a tear to my eye because, as you'll hear in the episode, Dr. Dave has played a very large role in my healing journey, physical, mental, and spiritual, since I first stepped into his office 10 years ago after being referred by my midwife to receive acupuncture during my pregnancy. I am very grateful that I was led to him, and I have a very deep respect for the work that he does and the approach that he uses to treat his patients integratively and as individuals, with a depth of compassion that can only come from having done the emotional and spiritual work on oneself. And that's why I trust him. I know that he walks his talk and always feel that he is treating me not only with care and respect, but as an equal. I truly wish that more people could experience this type of healthcare, or even just know that it is possible. And that's why I recorded this episode. I hope you enjoy. If you find value in this episode or any other episode and would like to support me in getting the podcast out to a wider audience, you can make a donation. Currently, I'm not trying to make a profit from doing this podcast, but I really do believe in the ideas, people, and different healing modalities that I'm sharing with you. And I would love for more people to be able to benefit from it. Of course, there are other ways you can also help me. Share your favorite episode with as many people as possible and leave a review on whichever platform you're listening. This both gives me feedback so I can continue giving you more of what you like, and it serves to improve my ratings on the platforms. And honestly, I would just love to hear from you. I so deeply appreciate every message of support and thanks that I've received, and it really touches my heart when I hear that the content has been meaningful for you. Go to my Instagram account, click on the link in my bio, and find the tab labeled Support the Podcast. You can donate as little as $5 or even less by entering a custom amount. Any amount will be greatly appreciated, and once I reach $100, I can use that for marketing the podcast and getting this info out there. And now on to an uninterrupted podcast with Dr. Dave. Thank you for being here. Appreciate your time. I'd like to start off with you explaining what is homeopathy, because I find that a lot of people have a very big misunderstanding about what it is and how it works.
Thank you, Rain. It's a pleasure to be here. I would really want to start with the opposite and really talk about what homeopathy isn't, because there are so many misunderstandings and myths about homeopathy, and it never really gets transmitted correctly in its true form of being both a science and an art, and structured in very specific principles of practice. So, and I get asked the question often from people, oh, you're a homeopath, do you have a natural remedy for something? Or you're a homeopath, can you tell me what vitamins to take? And homeopathy is not vitamin therapy, it's not supplement therapy. It's also not phytotherapy, which is the European form of herbal therapy. So it's not about prescribing herbs. It's also not about the Eastern herbal systems, which are Ayurveda, and in terms of Chinese medicine, you also have Chinese herbs too. It's not iridology, and so it doesn't fit into any of those categories at all. And people often mistake it for that, and they'll tell me they've got a homeopathic remedy, and it's not a homeopathic remedy. It doesn't follow the principles of manufacture of a homeopathic remedy. So that's the first thing to get out of the way. The second thing is that it's all natural, which is not the same as saying that it's less harmful than medical drugs can be or pharmacoactive drugs can be. And when people hear that it's natural, and they hear that, oh, we're using snake venoms perhaps, or spider venoms, or certain toxins and stuff, then they can get quite confused about that aspect as well, that we're using a wide range of drugs, but I'll explain that a little bit later. So, having got that out the way, it is still true that homeopaths will use all those modalities. So they will prescribe, and they will look at a person's nutritional status, and they will sometimes use certain phytotherapies or Chinese medicine. And also, many homeopaths are qualified in other disciplines like naturopathy, osteopathy, or acupuncture.
As you are, right?
Yes.
Okay.
And also in Chinese medicine. So they would combine it with acupuncture, and your prescription then might contain a homeopathic prescription as well as a Chinese medicine. And they work in very different ways fundamentally, and we can explore that further later as well. So that's what homeopathy isn't. So to try and explain it in simple terms as a science, I need to go back to the originator and the discovery of homeopathy, who was a doctor called Samuel Hahnemann. And in his days, over 200 years ago, medicine was pretty crude. And he became very unhappy with what he saw what was happening, and how patients were being treated with drugs that were actually harming them rather than helping them. So he stopped practicing just for moral, ethical reasons, and he started translating journals, and he could speak 7 languages. He was a genius, very, very smart man. And in translating one of these manuals, he saw that there was a correlation between cinchona tree and the bark, which gives you quinine, and the ingestion of that accidentally, and the symptoms it caused looked like malaria symptoms. So when you overdosed on quinine, people got malaria-like symptoms. And he looked at that and went, wow, maybe there's a connection. Now, he wasn't
That's very
the first. He wasn't the first person to notice this. It had been noticed by previous medical people in the past. And he then wondered if this was happening, could it be a principle of practice? So he then delved further into it, and initially what he was doing is, if he got patients that, for instance, had symptoms of arsenic poisoning, he would then try giving them very low doses of arsenic to see if that would help mitigate that poisoning process. And of course, sometimes that didn't work. And what he stumbled upon, which is the genius of homeopathy, is he started diluting the medicine further down. But in that process, he was succussing the medicine if it was a liquid, which means he was banging it really hard, vibrating it, between each step of the dilution. And if it was a powder that he was using, he would grind it and grind it and grind it for each stage of the dilution. And what happened was he discovered that released some inherent potency in the medicine that through the dilution process and through the potentizing process made it act in a stronger way on the vital force. So what was happening is that you were no longer having the active molecules that you would have in an active drug, but you would have a vibrational resonance that would be released, that would then work on the person's vital force. He then went on to expand this concept, and he wrote enormous amounts at the time. He researched hugely, and he started using people to do provings with. So he was giving people the substances over a period of weeks and seeing what symptoms they produced, and then he was linking that and recording it, and through that he developed a materia medica and a repertory that's got all the various symptoms that people may have. So that's the foundation of how the drugs work. Now, that was before antibiotics, before cortisone and so on. So it really did take off because it was a superior medicine of the day. So it got a lot of adherents, a lot of followers. Of course, as medicine has evolved and homeopathy has also evolved, there's been a lot of antagonism and there's been a lot of polarization of these two systems. And that's what we're seeing in the whole world today. We're seeing polarization politically, we're seeing it over vaccines, that people can't find this moderate middle road where it's not either or, it's both and. So, one can use homeopathy with conventional medicine. There's not a problem there. It doesn't have to be one or the other. It's about what's appropriate and what's indicated. So now, with modern research methods, amazing discoveries are coming out that although there are no more molecules in that particular potency that we use, the nanoparticles have gone up exponentially. So there's some other factor that has been introduced here that previously we weren't actually able to discover from scientific experiments. The other things they've done is they've taken those potencies and they've frozen them. I think it was one of the people who did the research on water, and then looked at them under a microscope and discovered that the structure is completely different to what you would have if you just had ordinary water that you'd succussed up and you hadn't had this ingredient in it. So it's been a sticking point with medicine, and I remember one person saying homeopathy is the same as putting a drop of our medicine into a river and thinking it's going to do something. And that is so far off the reality of what it really does.
Well, I know from personal experience how powerful a modality it is. And let's talk about that, because you started talking about the succussing and the grinding, and I know that to a lot of people, as soon as they hear that, they're going to go, whatever, it's some sort of witchy, woo-woo, magical, obviously doesn't really work. But I love the fact that they're now showing scientifically that something happens. Have they yet been able to determine what it is that happens through the succussing process?
Besides the fact that these nanoparticles are released and that they actually increase through this process and that there's a different structure, going back to the original principles of Hahnemann, he spoke about working with the vital force, which is another concept that people start getting apprehensive about, and I don't know why it's so difficult to understand, because it's just basically what a person's vital energy is about. And in the East, we've got prana, we've got chi, we've got kundalini, we've got all these other aspects that describe some other kind of energy in the body. And we know the body is an electrochemical milieu. We know that, and even like vitamin C can act in an electrical way in the body, not just as a nutritional substance. But there's something else as well besides that. And it's not going into a spiritual realm. It's not going into soul and spirit and that kind of thing. It really is, when someone's alive, you can see their vital force is either good or bad, or whether it's raised or whether it's depleted. Mm-hmm. And when they're going through a dying process, there's something that starts changing. All the organs are there, all the hormones are there, all the chemicals are there, everything is there, but something withdraws. What is that substance? And just because we can't see these things doesn't mean they don't exist. As someone once said, if you can measure it, it's not important. If you can't measure it, it's hugely important.
Yeah, I love that. What I find very frustrating today is that it's almost like science has become a religion of its own. And obviously even more so now, over the last 2 years, it's become this dogma that you're not allowed to question. And to me, that negates the entire purpose of science. Science is supposed to be about constantly asking questions and constantly testing the theories, trying to prove them wrong in order to prove them right or to discover something new. And so for me, it's exactly what you just said in that saying. It's about when we can't yet measure something or prove it or see it with our eyes, to me, that doesn't automatically mean that it's not there or it's not true. It just means that we haven't yet discovered how to understand it or how to measure it. And so it frustrates me when people say, oh, well, it hasn't been proven, or it's not peer-reviewed, or I can't see it with my eyes, and therefore it must be rubbish.
I agree, and I think, we've lost sight of the great geniuses and scientists of the past, like Einstein, who said he did not discover his theories through intellectual effort.
Yeah.
They came to him through inspiration, which is a completely different thing to the reductionistic, mechanistic, model that we have in science, which says that only material matters.
Yeah.
And in my years of practice, more and more has been discovered, more and more things from a scientific point of view with quarks and subatomic particles and so on that we didn't see before. Now we can see them. Some people do see energy. Some people do see auras. Some people, we can't negate these people. Some people do have visions of, premonitions and things. I've had it in my own family with family members who've seen something happening and it happened. And, you can't, because it's uncomfortable, pretend it's not real.
Yeah.
So that's the one aspect that, even Einstein said, our biggest delusion is to believe that we're all separate selves. Now that is quite a concept to really take on board, because we live in such a separated, polarized way that we do not see ourselves as one humanity and one earth, and if we did, our approach to healing would be very different as well.
I love when I read quotes by amazing minds like Einstein or Nikola Tesla or even Isaac Newton, and the quote will go so against what mainstream science thinks today. And then you've got these people quoting all these brilliant minds from the past, but not really taking into account the full breadth of their work, which wasn't just the materialistic, scientific with a capital S stuff. They all had this different side that was very intuitive and connecting with the stuff that we can't yet see and can't yet measure.
To take that a bit further, if we just digress a little into the field of acupuncture, which is reputed to be 4,000 years old, it has an incredibly rich history and an amazing background of understanding the universe in a different way and understanding the human being and illness in a different way. And I was once on a panel with a professor of medicine, and we were having a very antagonistic discussion. And he brought up this question of placebo and said that as far as he's concerned, acupuncture was all about placebo. And I said to him, you just insulted a whole nation. Yeah. And you insulted 4,000 years of practice that people have found benefit from. But on another level, you also use this term placebo without understanding it, because the majority of medical research on drugs has an element of placebo effect that we know about. Yeah. And in some of those studies, it goes to as high as 40% of people doing well on the inert substance. Mm-hmm. So I think that's another kind of fallacy and myth that we need to dispel, that, you know, it's almost as if placebo is, first of all, nonsense, but it works.
Yeah.
But no one is really taking the bull by the horns and investigating how well does it work, because we should then be marketing placebo.
Well, that's exactly what came to mind now as you said that, is if the placebo effect works so well, then why aren't we studying how to harness that?
Correct. And
I could answer why we're not studying that.
I'm sure.
Because there's no profit in
it.
Yes,
very much so. Very much so. And they've said that often about homeopathy, and it then doesn't explain the incredible response that you get from animals. And lots of work has been done on horses, for instance. They're very, very sensitive. And it's amazing how they respond to these vibrations and how quick it is as well. Mm-hmm. And of course, you've got children.
Yeah, I was about to say, I've seen with my own son, I've been using your medicines on him since he was a baby, and you know, the proof is in the immediate improvement.
Correct. And that is another point that is important, is that people think homeopathy is slow to work. And yes, you know, someone came to me the other day, and the 11-year-old has been sick since he was 3, and she said, how quickly will we get results? Well, that's going to take a few years of undoing, so it's going to take longer. But when it's not a chronic condition like that, when it's an acute condition, it will work as rapidly as any other antibiotic would.
Yeah.
And we know today, I see many patients who are onto their 3rd antibiotic because the first one didn't do it and the second one almost did, and so on. So, you know, medicine's not that precise anymore from that point of view. You know, it has its strengths, absolutely, in terms of surgery and accidents and, you know, that area. But the area of chronic illness and increasing metabolic disease, increasing immune dysfunction, we live in an obesogenic society where people's nutrition has gone really, really crazy. You know, all of those things are creating enormous new problems.
Yeah, and they're all becoming so prevalent, and it's clear that the allopathic medicine is not helping for that. And so it really is time for these alternative ways to become more mainstream again, because people don't realize that homeopathy was the mainstream way.
Correct.
Before Rockefeller medicine.
Correct.
And I think if people can start turning back to these types of methods, and as you say, also addressing what we're eating and all of that, it will improve these chronic conditions that are unfortunately becoming like really epidemic proportion.
They're increasing dramatically.
Yeah.
Some cancers are increasing dramatically. But you're so right, because what saddens me through all these years of practice is that we tend to get people that have reached the end of the road. So they've already been through a lot of medication, a lot of treatments, a lot of interventions, which has weakened that so-called vital force. And, you know, side effects that you have to drugs do the same thing. And if people used us as a first line, they would save themselves so much damage in the future, if you like, so much unnecessary prescribing. And medicine will admit that they have overprescribed antibiotics worldwide. They will admit that they've overprescribed some of the other drugs as well worldwide. And I understand how that happens. I understand that there's also a need for patients when they come in to walk out with something and feel that they've had some help. You know, to send someone home with a flu and tupanada and say, that's all you need, you know, feels very neglectful. But yeah, we can quite easily be first line caregivers, because we go through the same medical study of diagnostics, anatomy, physiology, and it's important for all of us to do a medical diagnosis and to use the full facilities of scans and blood tests and everything else, so that you know what you're dealing with. And if one needs to refer, then you can refer.
Yeah.
But a lot of it is education, because one of the big misnomers is that the minute a child gets a fever, just suppress it. And mothers feel better if they've got rid of the fever, regardless of what's going on. What we don't understand is the fever is curative. As long as you don't have an underlying serious illness that is not self-limiting, like an acute pneumonia or something like that. But with most children's fevers, they're not serious, but the body is actually working, and it shows a really strong immune system. It shows a strong vital force. And what we do is we shut down that vital force, we suppress it, and just like a lot of drugs suppress the end result, they don't actually get to the cause.
Yeah.
So, it would be much better if we were working together, and I think we'd have a healthier population of children. And a lot of my experience has been in the past that I'm really so blessed working in this field, because I haven't really done any harm. And homeopaths are the least, we hardly ever sued for anything, because we're just not working in that dangerous space that doctors work in, which is really, difficult for them, no question. But our drugs don't have those side effects.
Yeah.
So a lot of people have benefited just from coming off all the medication and being put onto something different that just takes so much of the stress off the system.
Yeah. Well, I've certainly, over the years that I've been coming to you, it must be 10 years now, because Gavi is 10 years, what I've learned is that, opposed to when I used to go to normal doctors, when you get sick, you leave it and you leave it and you leave it until you're really sick. And you sort of only go to the doctor when you think it's bad enough that you are going to need antibiotics anyway, because that's what the doc's going to give you. Whereas now, I like to come to you as soon as I get my first symptoms. Because I know that if I get the medicine really quick, I can stop it before it even starts. And I won't actually get sick. And whenever I don't do that, and I think, I'll be fine, I'll leave it a few days, and then I get really sick. And then it's, Dr. Dave, help me. But I've certainly found that principle of it being a first-line defense.
Absolutely. Preventative in many ways. Yeah. And it's also very deep acting. So, when we're talking about acute and chronic diseases, they're treated very, very differently. And going back to the original principles and practice of homeopathy, we've got this huge range of medicines. So, thousands. But, in a daily practice, we're using, between 30 and 40 maybe that we choose from. But all of those medicines have been proven fully on human beings, and all the symptoms that they produce has been recorded in our repertories. So we've got this vast array. And as a homeopath, when we're treating a patient for the first time or a chronic illness, we want to try and find the constitutional remedy, the one that fits them perfectly, based on the simillimum stuff. So when it's an acute, it's a simillimum to the acute, not to the person in general. So what makes it very different is that, and what got me into homeopathy was I saw that they gave preference to mental symptoms. So when you're questioning a person with any kind of illness, it's very important for us to elicit what those mental, emotional responses are to their disease. So there's the disease, and there's all the symptoms that go with that disease, which may be general to everybody, but then we go into more particulars around that disease. You've got a fever, that do you want to be uncovered, or do you want to be covered? And you see this acting out all the time. You've got a sore throat, do you want to drink hot water or cold water? These very fine definitions get us closer and closer to that particular drug that's going to cure that person. So understanding that the mental symptoms are important takes us into the deep psyche of the person. And the remedies then start acting on that level as well. So that's one aspect of it. There's the other aspect where we're looking at the hereditary influences, and we're also looking at generational trauma, which is generally very prevalent as well. And also, how was the birth and how were the first 24 months of life? Because a lot is laid down during that period that will influence that individual later on in life. So it becomes very comprehensive, and that's what we mean when we talk about going to the root cause, delving really, really deeply into that particular picture, until we can find that drug that suits that constitution. And now we're doing constitutional prescribing. So even though the person is more or less okay, if we give that to them, they're going to experience a sense of well-being. And even sometimes if they've got a physical problem and you give it, sometimes they'll come back and say, it's hard to explain, I've still got this problem, but I feel good.
Yeah.
And I go, yay, it's working.
Yeah.
And that there are laws as to how your symptoms should disappear in the reverse order that they occurred, from top down, from within out. So we're watching the nature of all of this and seeing that everything's going along this healing path that was defined very specifically by Hahnemann and by other people like Hering, who gave us the law of cure. So if I'm treating somebody for something and they throw up a new symptom, if it's from the past, I know that can be a healing crisis, it's okay. If it's totally new, they never had it before, then I'm off track. So we have many, many principles that guide us towards this, and that's where the art kind of comes in, because refining that whole process takes a lot of sensitivity and also a lot of inquiry. And people today don't really have that time. What would be perfect is if they filled in a 24-page questionnaire, but if you give that to people, they tend not to come because it's just too tedious to do. So I have to do the excavating myself.
Yeah.
But that's the complexity of it when we go into the deeper layers of the person, and especially the kind of hereditary things that come through, and strong things like alcoholism in the family background that have a huge impact, and various illnesses as well.
I really loved listening to you explaining all of that, because it was actually the next point that I wanted to bring up is this, you describe it as an art. And that was something that I saw when I first started coming to you. And I think it's what drew me to choosing homeopathy over Western medicine, in addition to the fact that it was working, was that I'd come from this background where you go to a doctor and the consult is maybe 15 minutes and inevitably it's antibiotics. And they don't really ask you many questions about what you're feeling. It's sort of a very surface conversation. And I thought that was normal. I mean, I'll never forget, I think I'd already just started coming to you a little bit. And then I went to a doctor here in Sandton who had 2 rooms so that he could have this constant conveyor belt of patients coming in and out. So you would have one patient in the one room, quickly see them for 5 minutes, prescribe an antibiotic, and then while you're busy picking up your bag to leave, he's already off to the next room. And because I'd already seen you and seen the way that you work, when I saw that and I experienced it, I was like, actually in my mind I was like, fuck you, like you just took my money and you gave me no care. You really don't care what the outcome is for me. You just want to make sure that you get your 600 Rand, 700 Rand plus your whatever you're getting for prescribing that drug. And in a complete contrast, when I came to you, I remember the first time I had a full consult with you, I was so surprised at what you were doing. And I was almost sitting there going, what is happening right now? Because you would ask me a question, and then you sit and I can see you're thinking. And then you would think for a bit, and then you turn around and you take a book, and then you read something, and then you ask me some more questions. And I was just fascinated by the whole thing. But more than that, I felt like you were actually seeing me. And, you know, that was just coming. I first came to you for acupuncture while I was pregnant because I was overdue, so to help my labor come on, yeah. And so because I'd just been through that experience of pregnancy where in the very beginning I had a gynae who I felt was very patronizing towards me and wasn't hearing me or listening to what I was saying. Thankfully I fired him and I got myself a midwife and a gynae who knew what she was doing. But, you know, coming out of that experience and then realizing that actually there are different healthcare practitioners that we can choose who will really sit and listen to you as an individual and think about what is happening to this person, not, oh, it's this symptom and this symptom, okay, everybody's getting it, take this drug. And so that's what drew me to continue using you, and then eventually you became my main healthcare practitioner for absolutely everything, and I haven't been to any other doctors in the last
That's
decade.
what tends to happen.
Yeah.
So it's really about becoming healthy. You know, it's not about just managing illness. There's a huge difference between those two. And I see the kind of need in medicine to compartmentalize, and it has its value for medicine and sometimes for people. And, you know, I often say, if I'm referring someone to perhaps a surgeon, I'm going, he is definitely the best, and you're not going there for bedside manners, so please, that's what you're going to get, okay? Don't expect a whole holistic thing. We'll support you with that, you know?
Yeah.
And that's what people need, of course. They need more of this holistic approach of who holds your hand when you're going through this whole thing of sitting, waiting to have a brain scan, like I had last year. And it was very sobering for me to be a patient again and to be going through that process that you described, but also I felt I was in really good hands. Everyone knew what they was doing, and I would get to the outcome that I wanted, but I needed medicine to take me to that outcome, but I also needed other support, and I knew I wasn't going to get it from that place. So what you touched on here, Rain, is so important, and that is patients taking responsibility. So I had a colleague once, I haven't had the courage to put it up on my wall, but he had a thing on his wall saying, "You're looking for a good doctor, I'm looking for a good patient."
I love that.
So it's a very real thing, but for me, the way I see what has happened has evolved over my lifetime of practice is that the kind of trust has broken down because so many intermediates are playing out in the medical model. Medical aids are being introduced, companies or clinics are, they're all managed in different ways, and the doctors are kind of pawns in this whole thing, trying to do their kind of healing process, but they're being dominated by all of these other influences and demands and unfair expectations very often. So it's quite complicated, but it needs a lot of healing. The healthcare system, worldwide, it's not just here. But responsibility is huge, and people have got so used to coming and dumping their symptom on the table and say, fix it. And it's like, no, but you got it. Don't give it to me, kind of thing. And I think homeopathic work and prescribing helps people also to become more aware of their bodies. A lot of people come in and they aren't aware of anything below here. Yeah. And when you start asking the questions, it's a bit surprising to them, and weird as well. I'm beginning to realize now as I talk to you how many patients must think how weird I am that I'm asking these silly things, And maybe I need to spend more time doing this introduction for them. But I'm just happily going along, being really excited that I've got somebody new because there's no repetitive stuff in practice, and that's why I'm still enthusiastic after so many decades, because every person that comes in is a new being, with a new presentation, even though, it might just be the same kind of thing that I've seen 1,000 times. This one is different. This one is unique. Going down that path, and I've always seen this possibility of depth homeopathy, which then starts integrating the psychology and everything else. But we face many obstacles. And that brings me to one of Hanuman's teachings was the obstacles to cure that we have to look out for as well. Because sometimes people say it doesn't work for me. Well, either you've got the wrong medication or there's some obstacle that we need to, and that's where you've got to look at nutrition, you've got to look at relationships. An abusive spouse can be an obstacle to cure.
Yeah.
There are a lot of other things in the environment that play a huge role. And but once you take responsibility, it can be such a wonderful journey.
One of the things that I found really valuable about having you as my doctor is that you have always, you're constantly educating me on how to take control of my own health, which is the complete opposite of the Western medical model, where you are reliant on the doctor and reliant on pharmaceuticals. And, I've been coming to you now for 10 years, and it's not like you told me some stuff in the beginning and then that was it. I feel like I learn something every time I come to you.
Wonderful.
And you've had a very big impact on the way that I view my own health and in my understanding that I am in control of my body, whether or not I want to face that fact.
Correct, yeah.
You said sometimes people say it doesn't work for me. I've heard that a lot as well. People say, I tried homeopathy and it didn't work for me. And it was interesting how you mentioned the obstacles, because that can also take us back to the placebo effect, or its opposite, the nocebo effect, of if you so vehemently believe that this is not going to work, it won't. But also, it brings us back to the art of homeopathy. Because for me, witnessing how you so carefully do that excavation and ask about all the different symptoms and everything, and then spend time thinking about it, to me that says that it is such an art and requires such skill and a certain type of mind to really make the most of it and make it work. And so perhaps somebody went to a homeopath who doesn't quite yet have all the pieces fitted together. Would you say that's true?
There are many different schools of homeopathy, and in the past we've had the French school, and the German school, American, British, and previously there was a British Royal London Homeopathic Hospital, and there was one for children. So it really had its heyday then, and they all had slight differences, and every homeopath has got to decide where they're going to fit into this evolving system. In India, it's absolutely massive. There are homeopaths in every village, and they share their experiences with us. And because they don't have access to all the first world interventions and X-rays and scans and bloods, they do amazing work on terminal cases, on really, really serious illness, and it's just remarkable the results they're getting. But you made me realize that most people will come expecting, like I said in the beginning, just a natural alternative. How many times I've been asked, do you have a natural alternative to Dormicum or to a benzo? I mean, no, a benzo's strong, you feel it. It will knock you out, We don't have that kind of stuff unless you want to do psychoactive drugs, which is a different healing story. But so there isn't a substitute of like, oh, give me something safe and herbal for something that's not safe and not herbal. So they have that expectation, and then they go away, and maybe nothing changes after that first prescription, and they'll say homeopathy never worked. Like, I've met people who have said to me they tried therapy, it didn't work, and I go, what did you do? No, I went once. I tried therapy. I continued for 26 years because of my childhood drama, and it helped me inestimably, absolutely unbelievably how much, and I needed it. But yeah, I didn't go once, I mean, that wasn't going to crack it. I would have liked to have had in the beginning. That's what I said to my therapist. I'm just coming for a month and then I'll be fine. So yeah, one's got to really stick with things sometimes and learn about it and open up to it. And people are so overwhelmed these days that they just, have limited resources to take this kind of thing into their fold. If they're medically orientated, it's much easier to stay with what you know. And we've seen that with vaccinations, people just go on with what they know because they did it to their children. Well, I didn't do it to my children, but most people do. So the obstacles are exactly that, a lack of education. We probably should promote ourselves better. We should spend more time in getting that public awareness going.
Well, that's what this podcast
wonderful,
is for.
And that's I'm so grateful to be able to share that people can get a deeper understanding. And even in some of the medical courses now, they occasionally touch on these things and ask the students to do some research. So there is an opening up.
That's good.
But I also see with medicine, those students are really hard pressed. They're under enormous pressure even before they get into the wards. They don't think about anything else.
Yeah.
By the time they're qualified and got to pay loans back and everything else, they've got to just do what they do well now. To start going like, oh, what about homeopathy? It's not going to happen easily. So fortunately, we've got good university courses now that are putting out homeopaths on a regular basis. Yeah, but the education part is really vital. And as I say, even that keeps evolving because a lot of people are practicing homeopathy in the way you can practice medicine. That can also happen.
Yeah.
And it's hard because we have to spend more time with people. If we really want to get into the nitty-gritties, and that costs, and so on.
I very often, whenever I have the opportunity, I recommend you to people. And I'm always sort of saddened by how shocked people are when I tell them, when I go to Dr. Dave, he spends at least 40 minutes, if not a full hour, with me. And, he really digs deeper and finds out what's wrong. And they're so surprised by it because they have no reference for being treated that way by their healthcare professional. How did you get into homeopathy? Was it your first choice as a young person to study, or what led you there?
Well, given my youth, it was a pretty confusing time, and I really just adored animals. I only had one dog, but I had this thing for animals. And there was a wounded healer in me that was dormant, and I thought at the time that I should either be, in those days it was a game ranger, because I went to many around wild Africa.
Yeah, I wanted to do that too as a child. Be a wildlife vet.
Yeah, absolutely. So off I went to Pretoria University and started a BSc, thinking I would go down the way of veterinary science. And then at some point, my mother went to a homeopath. She had physical things that she couldn't manage besides her untreatable mental condition. But this homeopath treated her, and it worked really well. And I was suffering with sinus and congestion at the time, which, surprise, surprise, every day I walked back to my digs from lectures, I would buy a litre of milk and a fat cook. And then on the weekend we would have beer. So that was a perfect storm to be walking around with all this congestion. But I went to see this homeopath who was a pharmacist who then studied homeopathy, and he had this apothecary downtown in Jabir Park, and I walked in and I just felt I'd arrived in this mystical place with all these medicines, and I was totally enchanted. And he prescribed this stuff for me. Obviously stopped me, drinking a litre of milk and a fat cookie every day, which probably cured me anyway. And I then started looking into homeopathy, and that's where I discovered that it puts so much emphasis on people's mental conditions and mental symptoms. And I had felt throughout my childhood that the people around me were in serious trouble. I mean, I looked at the adults and there was confusion, there was a huge degree of addiction and stuff. And I looked and I thought, these people aren't okay. This isn't the way life should be. Mm-hmm. And I read a book called Battle for the Mind, and I realized, wow, the mind is so important. And I became fascinated by that. And homeopathy had that aspect to it. So I kind of came in this obtuse way because, it spoke so much about mental symptoms, general symptoms, and that began my journey. And really, I've never looked back. It's been difficult years sometimes. There's been a lot of legislation changes and things we've had to fight in Parliament, and a long story, very interesting. But yeah, so it was actually thanks to my mother in all her glory.
Yeah, it's interesting to hear you talk about how much you love the mental aspects of it, because I think at the end of the day, that is the biggest thing that I've gotten out of having you as my doctor. Mm-hmm. It started off as just being a substitute for a normal GP, but it then morphed into me coming to you for therapy after my divorce, and that's been profoundly impactful on me, having you support me through that, and then through my brother's death. And it's now gotten to the point where I haven't been coming to you for therapy as much lately, but at a stage I was coming to you regularly for therapy and hardly ever for physical ailments. But there was so much healing in that. That I think addressed a lot of the physical stuff in the end.
And therapy is kind of like a homeopathy.
Yeah.
It's meeting another person in that absolutely non-judgmental, accepting place to allow the acceptance for healing to happen. Mm-hmm. So healing is far more complex than giving a drug. You've described it really so well from that point of view. And even then, I do remember using certain remedies, for shock and for trauma and for loss. And in homeopathy, we've got all these amazing drugs that you can use, that you can give at those times, not just rescue remedy, which, by the way, isn't homeopathy either. That's a Bach remedy. And a lot of people think... I even think of it as
exactly. It's not,
and that's not made up in a homeopathic way. So that's another one that's not homeopathic, but they're wonderful, and I use them too. But if you can prescribe for a person in that state, you can then mitigate the chances of that going into a later trauma or going into post-traumatic stress. And that's the value of these early treatments. So even with children, we look back to see, and it's amazing how many children have a kind of medical trauma. And, I certainly have that, I inject people and I do acupuncture, but don't give me an injection, unless it's going to save my life. But paradoxically, I can take blood and give blood. So, but that thing sits with me from way back. And if I had had certain homeopathic remedies, then it probably would have softened the impact of all of that. And I had a really interesting story in terms of understanding how we get these drug pictures and the different medications that we use. Is that we've got a remedy called the Datura, which is a very interesting one. We see it growing all around. It's like that thorn apple.
Oh, yes.
It's like a weed.
The malt bitter. Yeah.
So it's one of our... It's a big remedy, so it covers a lot of symptoms, but one of the symptoms is waking up at night screaming, like children do with a night terror. And it will really help the majority of kids that have those night terrors if we prescribe that, and it will stop that awful condition. And when they wake in that state, they very often can't be consoled. They almost, their eyes are glazed and they can't see, and it's really very stressful for the parents when they're trying to manage a kid who's had a night terror like that. But anyway, that's the medication that we will often give. But I had a patient who had listened to his parents one night talking about their days of glory and naughtiness, and that they had tried Malpitta. And he and his friend that week, coming home from school, found the plant, and they ingested a whole lot of these seeds on the way home.
I just want to interject. Is Malpitta, is that the same as Datura?
Yes.
Okay. Right.
So by the time he got home, he was beginning to trip off his face. and no one knew what was wrong with him. And fortunately, early enough on, they found out what he and his friend had got up to. So they thought they would just wait for a while and see what happened. This escalated to such a level that they ended up at an emergency clinic.
Yeah, because they're very dangerous, right?
Well, not physically. Probably the worst thing you can do for psychosis and for the worst hallucinations.
I remember as a kid there being like, I don't know if it is a housewife's tale, but that it will make you lose your mind.
Pretty much looks like that when you're on it. Yeah. not something to play with at all. No. The worst imaginable, even as gung-ho. I know one particular person who told me that they did it in a group, and the one person just wandered off the cliff, and that was the end of him. So this young man, and for me it was, interesting because he was displaying everything that we have in the provings. He was trying to walk through walls, he was climbing walls, he was seeing monsters, his body got bitten in half, disappeared. But they couldn't treat him in hospital. They didn't know what to do with it. They didn't know what the antidote was. So I said to the parents, take him home, and you're going to have to sit him through this. But we can also prescribe to try and mitigate the negative impact on him. But in this particular proving, it's got hydrophobia, which is a fear of water. He was dehydrating terribly, and every time they gave him the glass, he would knock it flying.
Wow.
And they couldn't get any water, and eventually I explained to them to hide it in a cup and a Tupperware, and then get it into his mouth, and he could get the water in. So all these symptoms came up that we see when children wake up with these night terrors and the kind of experiences that they're having. And it completely calms him down when we use it as a homeopathic remedy. And when you read the book, he displayed all the symptoms that are there during that intense thing. Now, if you see that as the actual worst possible picture for that drug, when you dial it back, you can get moderate symptoms like that in people.
Mm-hmm.
Like I'm not walking through walls and things, but moderate symptoms. And the stramonium psyche has a feeling of not being worthy, not being good enough, feeling like rubbish. And if you look at the plant, it always grows on rubbish dumps and on the side of the road. And it's not something you're going to plant in your garden and admire. And it's interesting that that deeper level psychological aspect to people who need this medication is there. So, you can prescribe it for the night terrors, but you can also prescribe it for a person. And I had that just a little while ago because there have been many, many kids melting down during COVID.
Yeah.
And this one young man who was doing very, very well at school and sat and said to me, I'm useless, I feel like nothing and nobody. So that picture comes into that, and that pulled him out of it. His dad phoned me a month later and said he's back to normal.
Wow.
So there are these, signatures, relationships that go on as well. But these poisons and provings of them are also very helpful. So
it's fascinating. Like I love hearing about this stuff because it sort of goes against everything that we think it should be, what we've been taught. And it does have that like sort of almost mystical side to it when you hear that. But I think that's the beauty in it, is that there is so much in the universe that we can't yet explain, and something like this taps into that. It shows us that it really is there, whether or not we can understand it or prove it, measure it. It is there, and it does work.
Exactly. The results are there.
Beautiful.
So it's really wonderful to be able to help in that way. This particular guy, he went for 24 hours non-stop, never slept.
24 hours.
The family were exhausted. They were totally wiped out, and he needed some follow-up counselling afterwards, because I was concerned that he could have flashbacks. Which
I'm sure he's never going to touch another drug again.
He was like, really overzealous with that entrance into hallucinogenics.
And then physically, was he fine after that?
No. There were no
just wears
physical
off, and then
complications at all. Well, exhausted.
Yeah.
Having been so manic during that period and dancing around, and they couldn't keep him still. He had some good times as well, and we were able to, fortunately, normalize it, and he understood, cognitively what had happened, and the parents couldn't even chastise him. They were so they were so wiped out. They didn't even have the energy to by then. Besides, they'd actually played a role in this because they were talking about it.
Yeah.
So be careful. Be careful what you share. Their ears listening.
I also want to get into how emotion manifests physically in the body, especially emotions that we're not processing. And now I'm not sure if this is going into homeopathy, or maybe this is more on the Chinese medicine side, which you practice as well. But how there's correlation between pain in specific areas of the body that points to certain emotions.
It's not directly my field, but there are certain correlations in homeopathy and acupuncture, for instance, around the lungs being the organs of longing and letting go. And that is stated in acupuncture philosophy. And in homeopathy, we have remedies that are related to that particular emotion that talk about unresolved grief. That can also then manifest in the lungs. So there are many other correlations that go on, and one can work with that, or basically just read that symptom in the present moment, knowing that it's arising from the past. So you're absolutely correct that all emotions get stored in the body, and lots of work has been done on neuroscience with this in mind, and showing what happens when you suppress those emotions, when you don't express them. And suppression is a big problem. Expression of your authenticity and of your purpose and of your right to be here in the world can get diminished during childhood, because the child has this duality of looking for attachment, which is really, really important. Because without attachment, they really, really do suffer. But if that attachment is coming at a cost to their authenticity, they'll give up their authenticity. So if a child is not allowed to be who he or she is, or how they're feeling, they will disregard that feeling so that they can still remain attached, because they don't want to make mom, dad angry, they don't want to be rejected. And then later on in life, that is going to emerge in some kind of pathology. And with that, we can go into a field like PsychoNeuroImmunology, PNI, which is something that I've also studied and practiced through sometimes NeuroLinguistProgramming.
PsychoNeuroImmunology.
Huge field of medicine, which is the nicest side of medicine, because it's where, on a simple level, mind-body relationship is correlated, and
right up my alley.
Yeah, the psychosomatics, so-called, have a scientific basis for them. In fact, even placebo can sometimes be explained through that PsychoNeuroImmunology, how all of those are intertwined.
Yeah.
And we saw this with COVID. I heard from 4 or 5 different medical sources how important a person's mind state was during COVID, and also going into hospital and perhaps being isolated into ICU. And certain mind states seem to be correlating with not such good outcomes. So that's a massive field. And, we're aware of it, but there are different ways of working with it, with whole major fields of psychotherapy and tapping and body work and craniosacral, all of that kind of stuff helps. Meditation, mindfulness, yoga, all of that is vitally important for getting in touch with that stuff.
I started using tapping last year. At a stage I went through a bit of a rough patch with all of this COVID drama. And I started using tapping, and I was really amazed by how quickly and powerfully it can shift your energy, your mindset, your emotions. Yeah.
And it's doing meridian stuff, of course, when you work there. So it's got its basis in acupuncture principles. But COVID has been a phenomenal wake-up call, and no one has been immune to this. And what people don't realize too is they're going to doctors that are traumatized right now. So we none of us are outside of this. And what we're seeing is how different people have reacted to the same stimulus. And that's again back to the individuation that we have in homeopathy. Our whole issue is to individuate every person, and biological individuation is not really recognized too much in medicine. And you cannot individuate only the biology, because that is a bigger person than their body. You're not your body, you're much more than that. So we've got to look at those other factors. And an interesting thing that came up for me was my reaction to COVID was not what most people had. And because I grew up in a chaotic environment, chaos is normal for me. And I noticed other people who had similar backgrounds were handling this very well. They were like, welcome to my world. This is where I've lived. Now you guys are experiencing it.
That has been my experience.
That you can almost feel like
just going, okay, we'll get through this.
Yeah, you can almost feel a bit guilty.
Just another crisis.
Yeah.
And then watching people around me who perhaps haven't experienced crisis or big trauma in their lives just falling apart.
Yeah. So, those are completely different reactions, of course, and they need to be recognized when we're making prescriptions and trying to help people. Not just, it's anxiety. You just get one thing for anxiety. It's like, no, how does that anxiety manifest? And the same for depression. It's a concept. Yes, it's a diagnostic thing that's in the manual, but at the same time, grief is not depression. Sadness is not depression. Pain is not depression. They all have very different nuances, but they all get treated under one umbrella, and therefore sometimes not so successfully.
I've had something interesting happen this week. So I've had this pain in my thumb for a couple of weeks already, and I keep on thinking I just need to roll out or stretch out the fascia in my palm, and then it will fix it. But I keep on forgetting, because I only feel it with certain movements. Actually, I feel it when I pull my pants down when I'm getting undressed, and that's the only time I feel it. So I keep on forgetting about it, and it's not that serious. And then a day ago or 2 days ago, all of a sudden I have the exact same pain in my big toe on the right. So both on the right side, thumb, another big toe as well. So I just found that very
Fascinating.
interesting. Yeah. It always interests me how these symptoms show up in the body and where are they really coming from. And I mean, obviously, on a mechanical level, yes, if I stretch out the fascia of my palm, it's going to help. It's going to relieve that tightness and whatever. But where did it originate from?
Exactly.
Yeah.
Yeah. And it's a puzzle, and we have to put all the pieces together. As one of my teachers in homeopathy, Tagna, said, there's many entrances into the labyrinth of the human being. And that's why it's so important to give recognition to all these other various therapies that people are offering, and they're not replacements for anything else. They're adjuncts, and different people need different approaches.
Yeah. That's one of the things that made me feel right in the beginning that I could trust you was that you're not dismissive of Western medicine. And you said it in the beginning of this podcast that they can work together. And so I always felt safe with you, because I think in the past I had been to a homeopath who had more of an all or nothing approach. And then me as a patient, if I go to somebody like that, how do I know if perhaps this is the situation where Western medicine would be appropriate as opposed to homeopathy? If I don't know that you as a practitioner are going to refer me on when necessary. And that's why I feel that I can trust you so much, because I know that if you think that I need something else, a different modality, or I need to go see a certain type of doctor, you're going to refer me on. You're not going to be like, oh, don't worry, I can fix this.
Well, there's the other side to it, in that when I've tried to refer some people, they got really angry with me.
What do you mean you can't fix everything? Why do I come to you then?
Yeah, so there's that part to it as well, that people from their side could want an all or nothing thing, and that can be very stressful for us as well. But you'll find out eventually, everybody deserves the doctor they get, in a way. That's the bottom line. And one has to take responsibility for that too. And it's important that people connect. Yeah. It really, really is important. And that they also can ask the questions. There's this, when I'm, sending people back to an oncologist or whatever, I said, please take someone with you and make a list of your questions before you go, because you're going to forget in that moment of pressure and everything else. So have your list, have someone with you so they can hear the answers, because you're not going to hear the answers. You're going to be so stressed.
That's great advice for anybody. Very
important. And I think also, everyone has a right to getting second, third opinions. And it's very confusing sometimes, because you can end up with 3 opinions, and that doesn't really help you. And then do you keep going down this line, because it becomes very costly as well. But yeah, it's all part of finding out as you go along, and everybody's responsible at the end of the day, however they don't want to be.
Yeah.
Because that ignorance is bliss is not true. If you just kind of take what you're given and ask for more and more and more, you're going to get it, and then you can't turn around and blame the doctor.
Yeah, well, I think that's what happened with me, but I'm very grateful for it, because it's only led to good things. Actually, something that popped into my mind just now when we were talking about the physical manifestations of emotion, and one of my first very direct and obvious experiences of that was it was at a stage when I was still only coming to you for physical ailments, because I thought that was all that was possible. And it was towards the end of my marriage, and I had this thing with my throat where I just had this constant, it felt like a lump in my throat, but it got so bad that I was struggling to swallow my food, so I wasn't eating much. And I remember I brought Gabi to you for something. He was sick, and I mentioned it to you, and you said to me, what do you need to say that you're not saying? And it was almost like a slap in the face, because I'd never had a doctor ask me a question like that in response to a physical ailment, and it really got me thinking about where I was at in my life and what I was busy dealing with. And that was sort of, it was like you opened a window into this whole other world.
Wonderful.
Yeah, and then just went down a really wonderful path of actually addressing all the stuff that I'd been stuffing down, including my own voice. And look at me now, I have a podcast.
Yeah, but to recognize that you could actually take that on, that you could actually hear that, and that you could work with it.
Yeah, because like most people that know me today and know me as I am, wouldn't believe that, that was only 6 years ago, 7 years. I had this incapability of speaking.
Amazing.
Speaking my thoughts, speaking what I was feeling. And so to look back at that and see how far I've come, where I'm now so vocal about things, and sometimes get myself into trouble for it. That, to me, that is testament to the work that you do and how much you've assisted me in that journey. So thank you.
You're so welcome.
From my heart for everything that you've done for me and my son, and thank you very much for being here. It was a really interesting conversation, and I learned a lot from it, which is really great. I like to end off the podcast with something just a little bit more personal and lighthearted and unrelated to whatever we've been speaking about.
Okay.
Is there a book that you are busy reading, and or what is one book that you would highly recommend?
It's so interesting because I've seen people, or read people, answer this question many times, and I'm an avid reader, and I cover a lot of fields, from spirituality and metaphysics all the way through to medicine, and just recently read a whole tome on the history of cancer, and but we started to help our son read more. We started family time where we read every evening, so that he can be supported in his reading, because he's always disliked it, and now he's beginning to realize that he needs it with matric around the corner. So he's got a book, To Kill a Mockingbird, and I saw it's on the top 100 list, which he went through the other day and was checking how many I'd read on that list. And I felt so proud every time I said, I read that one, I read that. But there were a few that I was like, what? So, that's where I am at the moment.
Okay.
I'm reading, their school list books.
That's awesome.
So, everyone should read it. It's on the top 100. Have you read it?
I don't think I have.
Okay.
Damn it, now I'm going to have to read it. There's so many books that I feel like I must read, because as an avid reader and a writer, how could I not have read that book? Then on the other hand,
it's a lifetime journey.
I want to read. And then second question, what is the one daily practice that you would recommend everybody incorporates to improve their health or their wellness?
There are a few that I do, and I've just kind of chunked it up recently, and I've added to my repertoire of what I do on a daily basis and a weekly basis. But meditation has been something I've been involved in since I was 16, and in those early days I was also secretly doing yoga. Secretly, because it was the occult.
Evil.
So I was hiding out and standing on my head and doing all of this kind of stuff, and I was hoping that I was going to be visited by spirits and crazy stuff would happen. So I was testing this occult stuff out, and it stayed very quiet. I just got very flexible. But I became I'm a trained mindfulness instructor as well. And so meditation takes many forms, but for me, there is my kind of practice, and then there's my reflection. And I think the most important thing is to kind of approach the day from a centered place. And it doesn't have to be long, but you do need to stop everything for 10 minutes or more if you can, and just reflect on where you're going today. Where are you going on your journey and your life? I don't mean pick and pay Woolworths, but what are you actually doing? And are you living from the outside in, or are you living from the inside out? And what are you going to take into the world? And where are you going to be at the end of the day? And this is the only precious day you've got, which most people don't really recognize as impermanence. I thought that COVID would wake people up and say,
I think it woke them up for a minute.
Yeah, that this is your day to shine. And I don't mean it in that, over kind of emphasized positivity kind of structure. But just giving yourself that time, because there's so many distractions now. And so many directions that people are pulled in, that they lose that inner connection. And it's the most important thing.
Yeah, I think that's a great way of encapsulating it, because I start my day with my morning practice. I mean, sometimes my morning practice only happens after I've taken my son to school or had my first morning client, but I start my day with my morning practice. And if I don't, I have a very different day compared to when I do. And I think what you've just summed up so well is that then people want to know, well, what does it include? And it's less about what you're doing. It's more about just taking that time, even if it's just the 10 minutes, to do whatever practice it is that centers you. Yeah.
What suits you. And exercise, absolutely non-negotiable. Whether it's walking for 15 minutes or, doing yoga or qigong or anything, that makes a huge difference. Everyone who comes to me, I tell them 50% improvement of all your complaints if you just start exercising.
Yeah, absolutely.
So that's a big thing. Yeah.
Okay. Awesome. Thank you.
Thank you. It's been wonderful.
Thank you for listening to this podcast. If you enjoyed it, please like, share with your family and friends, and subscribe on whichever platform you're listening. If you'd like to connect with me, you can find me on Instagram @rain.dunn or email me on rain@raindunn.com to learn more about my different services and offers and explore how we can work together to help you find more vibrance and expansion in your life. Visit my website, raindunn.com.